My fiance and I, it was our first day of vacation. We've been looking forward to it for a long time. And then we went into River Nook, took our camp trailer, went into River Nook campground that's in Kernville. We probably got there 3 o'clock or so, 3 o'clock if I remember correctly. And got set up. I started sweating really bad. Sat there for a little while and tried to process what was happening. And trying to identify some of the stuff that people say, where the elephant's sitting on your chest and things like that. And I wasn't feeling any of that. So I thought, okay, I'm just gonna lay down and let it pass. And then a little voice told me not to do that. So they brought me to Memorial here, and I was conscious. And then we got into the ER, and I remember them taking me off of one gurney and putting me on another gurney, and then coding out, just going somewhere else for a minute. And then one of the nurses said, you have 100% blockage.
As long as I've been doing it, I was one of the busiest nights I've ever had. We were here taking care of someone with cardiac arrest, actually a transfer, and just as I was in the middle of it, we get a call, there is another heart attack in the emergency room. I ran downstairs to the emergency room, and they had the thrombolytic ready in the doctor's hand, and I just asked him, okay, we got it now. We quickly just got through. Within, I believe, the first 5 to 7 minutes, we had the artery opened, and he converted to normal rhythm, and it was just, with heart attacks, that's the most magical thing in what we do. Everything kind of changes, the whole scene changes, everything is back to normal. So that was beautiful.
But these people here in the ER, the team that was there the night of June 10th, they were incredible. They did a great job. Their bedside manner, everything was just, they were compassionate and thorough. And they kept me alive long enough for Dr. Sandhu to finish the job.
The difference between life and death could be a couple minutes. The arrest that he had in the emergency room, if that had happened 3 minutes before, the outcome may be different completely. So very fortunate. Him and I were talking about it. The stars just aligned for him.
I'm really proud of the staff that we have here. I'm proud that when I talk to physicians, they will tell me just what wonderful staff that we have here and their level of expertise and the skill set. And they feel comfortable and confident working side by side them during these high risk, complicated procedures. So that makes me very proud that we have this dedicated team of committed healthcare professionals that it's important to them that they provide excellent delivery and patient care.
May 23rd, I went to work like I always do, about 4 a.m. in the morning, and I went to a safety meeting at work and did all kinds of things, and went back to my office, and my briefcase is a backpack, and I put the backpack right on my shoulder, and instantly right there it caused chest pains, nauseous, dizziness, and I still didn't know what was going on. And thank God my wife Tracy came to the house and she saw me starting to faint out and pass out. And that's kind of where it all started. And then she called 911, and when they put me in the ambulance, they said that I just had a heart attack. At that time, when they told me I was having a heart attack, I was scared I was going to lose my life. I was fighting for my life. I felt weak. I couldn't do anything to myself, so I was relying on everyone to do the things to try to get me healthy again, is how I felt. They saved my life.
Some of the procedures that we are able to perform in our cath lab today truly are time-sensitive and life-saving procedures. So without that technology and the advancements in care that we've made here within our service line, those patients might not have otherwise survived that condition.
The technology's there, and I think it's getting better. I think it's less invasive than it probably when I went in. And so seeing all that is what's really important to Tracy and I. Plans are to get more involved in the community and see what we can do just to do better things for the community, and especially for the heart side. I mean, there's no doubt she's my wife, my beautiful wife, and when all this happened, when I was in the hospital, she took care of me and made sure everything was going the right way, and she's still doing that. If I start going off course a little bit, eating bad habits or something like that, she reels me back in. So she's my rock in my life, and I love her very much.